Good afternoon. Good afternoon. Thank you all for joining us. We'll get started in about 1 minute or so, but thank you all for joining us today. We're excited to share what we have about the TA new testing program. All right, it is exactly 1 o'clock. We want to be timely. I'm going to go ahead and get started. My name is Damon Hoyle. I am the Senior Operations Project Manager here at Texas Education Agency. And so I am on the team that handles a lot and pretty much all of COVID response when it comes to testing and so forth, working with school districts. I am joined today by my colleague, Dave Gruber, who will be presenting as well. He is the Associate Commissioner of Regional Local Health Operations at the Department of State Health Services, also better known as DSHS. So we'll go ahead and get started. So a couple of things we wanted to lay out just before we get started, just some webinar norms and reminders. So as we go through the presentation, I'm sure you all might have some questions, comments. Feel free to use the Q&A feature at the bottom of your screen to ask questions throughout the presentation. What we're going to do is at the end, we'll have about 15 minutes or so, and we'll go through as many questions as we can. I'll say up front, there might be some questions that I don't have the answer for, and that's okay. We will follow up via email, and then we'll also, if we see a pattern of questions or themed, we'll put them in an FAQ that we'll update very soon. So we will have a Q&A segment at the end. Some of them might be answered live while we're doing this, but we do have that time at the end, and some of them I may not be able to answer, but we will get to them later on. This session is intended for 2021-2022 TA K-12 COVID-19 testing project. I just wanted to emphasize that. I know there's might be questions on public health guidance and other things around COVID. This is specifically for the new COVID testing program/project. So wanted to kind of just name that. So please, you can focus your questions there. Lastly, last two things. Houston public and private school districts, there is a list. So the city of Houston received about $39 million from this similar grant to help fund schools within the Houston area. And so they've put out a spreadsheet that has a list of all the schools, and that's on our website. So actually, let me back up. I'm going to click on something right here. This right here is a link to our K-12 testing project. And so you're going to hear me reference quite a few things. Everything that I'm referencing, all of the links can be found here. And so I'm sure we're going to drop that link for you in the chat. So everything that I'm going to reference today, so that I won't toggle back and forth each as much, everything is right here. All of the links that I'm going to be talking about. So I'm going to go back now to the presentation. So that spreadsheet that I just mentioned is listed and it's on our website there. You can click on it and it'll have a list. If your school system is on that list as it stands right now, you're going to be supported by the city of Houston and you would not be receiving testing or support from us at this moment. If anything changes, we will let you know, but at the moment you would be supported by the city of Houston. And so just wanted to say that up front because we want to make sure we don't waste anyone's time. And then lastly, standalone pre-K centers and daycare, childcare centers. If you're standalone and you're not attached to a K-12 school, you don't commingle with those students, you don't interact with those students, you're not attached to the school. If you're alone, standalone, this is also a program that is not for you all. You're not eligible for this program. There are other ways that you are eligible that you can reach out to some folks for, but for this particular program, you would not be eligible. So we wanted to name that up front. If you're pre-K attached to a school, K-12, and you commingle with those students and staff, you're fine. But if you're a standalone pre-K or daycare, this program does not support that. So with that said, I'm going to go ahead and move on. I'm going to turn it over now to my colleague, Dave Gruber. Dave, you can take it away.
Good afternoon, everybody. Thank you for joining us today. So we're here, as Damon mentioned, to discuss the testing support to schools K-12, public and private, the ones that Damon had mentioned. And this is part of a grant that was issued by the Federal Department of Health and Human Services. And the focus of the grant is particularly on screening testing that support in-person learning at schools. And we'll talk about screening testing as it differentiates from other testing in a few slides. Texas received $800 million, actually $803 million for this initiative. And as Damon mentioned, the city of Houston separately received funding with the same grant guidance as the state, but to focus on the city of Houston. DSHS has partnered with TEA to make testing resources available to public and private K through 12 systems, and we'll give you more information about that as we go along. So next slide, please. Then. So the goal of this effort, again, is to provide the needed resources to implement a COVID testing program and support to returning to schools, I shouldn't say safely, with minimal risk as it relates to prevention strategies in all K through 12 public and private schools. Next slide, please. There are two aspects, as you all know, to what happens when you're trying to enact a program like this. One is to prevent things from happening, prevent students, staff, faculty from getting COVID. And the other activity is, should somebody be identified with COVID, how to respond to that activity. We are focused on the use of testing strategies for both of these, particularly for prevention in screening activities to try to prevent students, faculty, and staff from infecting others through rapid identification of those who might have COVID. However, should we find someone who is symptomatic, we would want to test them and see if in fact the reason for the symptoms that they're showing are COVID, and then be able to enact activities that you all have as planned should you have a COVID positive on your campus. Next slide, please. So this is the second of our seminars that we are conducting. And we conducted one last week from 9 to 10, exactly the same as this one. So if you missed that one and you're on this one, you're doing the right thing. If you were already on the one on Friday, you're more than welcome to stay with us, but we'll be repeating exactly what we did last Friday. Next slide, please. Okay, so in order to make sure that we're all on the same sheet of music, I want to go over some types of testing and then go into the use cases for those types of testing. Next slide. If you look on the left side of the slide, there are three major categories of testing: surveillance, screening, and diagnostic. Again, we're focused on screening, but surveillance testing tends to be the testing of large populations, not necessarily for the identification of individuals, but to see the prevalence of a disease, or in this case, COVID, in the community. That's differentiated from screening testing, in which we look at asymptomatic populations, those that are showing no symptoms at all of COVID-19. But we test them to see if in fact some of them may be carriers, particularly if they've been in situations where they may have been exposed to COVID-19, and to catch any either asymptomatic carriers or those who have just, let's say, become infected and may not be symptomatic at this point, but could develop symptoms. That's differentiated from diagnostic testing, which would be for individuals who are in fact symptomatic with the symptoms of COVID-19, or if they've been in close contact with someone who was either symptomatic and COVID positive, or who had a high risk of being COVID positive. Now, those are the categories of testing, but there's different types of testing. And if we look at them, we can divide it into two major categories: antigen testing and molecular testing. The difference between the two: antigen testing looks for pieces of the virus. Whether or not the virus is live or dead, active or inactive, what an antigen test will do will be identify a piece of a virus That means that the virus is actually in the body in some form. That difference differs from molecular testing, in which instead of looking for a piece of the virus, a structural piece of the virus, molecular testing looks for the genetic material of the virus, the RNA in this case, mRNA. And the molecular testing tends to be more sensitive than antigen testing. And the reason is that molecular testing relies on what's called NAAT, which is nucleic acid amplification testing. And I know that many of you are aware of these differences. And what nucleic acid amplification testing does, NAT testing, again, simultaneously used synonymously with molecular testing or PCR testing, is that it identifies and binds to a piece of the virus genetic material, but then it multiplies that material based on the kit itself, so that it's more easily identifiable, so that you're not just looking at that little piece that's in there, but there's multiple copies of that piece so that the test can pick it up. Now, when we talk about molecular testing, we talk of, and again, it's synonymously used with PCR testing, polymerase chain reaction. There's some things to point out here. Molecular testing tends to be done at a laboratory. The sample is taken on site, but the actual analysis is conducted at a laboratory. So unlike antigen testing, that you don't get the immediate results that you get with antigen testing, but you get probably more, I don't want to say accurate, that's not the right word, more confirmatory. You can count on a molecular test more than you can count on an antigen test. Not that an antigen test is unreliable. As a matter of fact, what you'll hear from us is that for most of you, if not all of you, antigen testing is probably better because number one, it provides quick results, but number two, it's a heck of a lot cheaper than molecular testing. Now, there are in fact some molecular or PCR testing kits that can be in which the sample is taken on site and the results are given on site. We are not making those available because number one, of the overarching expense, and number two, because they tend to be not as accurate as molecular testing is conducted at a laboratory. So if you're going to with molecular testing for some reason, the preference is to get that sample analyzed at a laboratory. There's another, it's not necessarily a type of test, it's a way of testing, and that's called pool testing, and you may have heard of that. What pool testing does is it takes a bunch of samples, and instead of taking a swab and putting it in its own little container for analysis, it takes a swab and puts it in a container, and in that container would be swabs from multiple other individuals who have been tested. And then that whole sample gets sent to a laboratory and looked at. So what's the advantage? I mean, you can't tell whether or not an individual is positive if you do pool testing. Well, the advantage is it can be cost effective if you're testing large populations. So for example, let's just say you're testing 10 different classrooms. And instead of, and let's say each classroom has 10 students. So that's 100 students you're testing. Well, if you do 100 tests, 100 individual tests, then you're going to have to pay for 100 individual test kits. But if you pool the samples, let's say for each classroom of 10, you put all of those samples in that one vial, in that one container. Now you have 10 samples that are going to the laboratory. If 9 of those come back negative, you don't have to worry about any further testing. But if one of those samples of those pooled tests come back positive, you do in fact have to retest those individuals individually. You can do that simultaneously when you do the pool testing so that the laboratory would have both. But the fact is that instead of conducting 100 tests, at that point, you only have to conduct 10 tests, that pooled sample that was positive, where the 9 other pooled samples were not positive. Next slide, please. So here are the pros and cons, and we're going to give you these slides so you can look at it. But in general, if you're doing testing for the majority of your purposes, antigen testing is probably the best way to go. It's cheaper than molecular testing. And while molecular testing can be more sensitive, the sensitivity of antigen testing is very good. I will note that you may be getting different types of test kits depending on which vendor you select, and we'll go into that later. All of the test kits that we are making available to you provide about the same results. They're all just as good. So just because you may be getting vendor X vice vendor Y and it's a different test kit, you should not be concerned about the efficacy of the tests. They're all good tests. So again, in most cases, antigen testing is what you would look for. If you are going to do, let's say, testing every week of everybody in your school, you may want to consider pooled testing. It's a lot cheaper. It will save a lot of money. And in general, it will provide you the results that you want when you want it. Next slide, please. So here's just the quick and dirty on antigen versus molecular testing. Antigen testing is a quick identification. It's less expensive, results within minutes, and non-invasive nasal swabs that can be self-administered. Next slide. Screening testing. So where would you do screening testing? Well, perhaps if you wanted to test a sports team prior to a game, if you had an outbreak and on your campus and you wanted to test children, or if you wanted to test staff and faculty prior to returning to campus, you probably want to do antigen testing. And if you wanted to test, let's say, your third grade teachers every week, probably antigen testing. Or again, you do have the option of doing molecular testing too, but that's more expensive and you don't get the results as quickly. Next slide. So diagnostic testing. What we had talked to up to this point is screening testing. When you have individuals who are asymptomatic or not showing any signs or symptoms of being sick. But if you do have individuals who are showing signs and symptoms, or you do have individuals who have been in a high-risk environment, and that can be somebody who's been right next to in close contact with someone who you know is sick, then you want to do diagnostic testing. And here's where you're testing to see if the person actually has COVID right now because of the signs and symptoms that they have or the situation they've been in. Although the focus of this testing program is on screening, we are supporting diagnostic testing with this program. Next slide. So we're giving you a lot of options, and we're doing that intentionally because we want you to enact the strategies that you have developed and make sure that the testing capability doesn't prevent you from enacting those strategies. So as far as opposed to being prescriptive and saying you must do X, Y, and Z, we are supportive of you developing your own plan in consultation with whomever you want to speak with, your local health departments, local health authorities, physicians who consult with you, and your jurisdictional leadership, so that we can provide you the tests that allow you to provide the testing strategy that you in fact have developed. Next slide.
All right. Thank you so much, Dave. Now I'm going to get into the testing program logistics. Thank you, Dave, for giving us that overview and with some of the vocabulary that we'll be using and talking about throughout the rest of the presentation. So just this notice again for anyone that joined us after we began, the city of Houston was awarded upwards of $30 million to fund their own testing program for private and public schools within the Houston area. We've provided on our website a list, and we'll have that dropped in the chat, a list of all the schools that are going to be covered by the city of Houston, public and private. That's currently updated. And so if you're on that list, then you, as of this moment, would not be covered or not be eligible, rather, for this testing program. So if anything changes with that, we will let you all know. But as it stands right now, those list of schools are not eligible for this testing program. So please check out that list to verify. All right, so the testing program is here to cover and to answer or to provide four things. The first thing is, as Dave already touched on, access to antigen point of care testing. Last year, we had a testing program. We did a survey at the end, had quite a few folks respond to it, over 300, and you all gave us feedback. And you said, if we had a testing program this year, what would you want? And these were the four things. Antigen testing, because it's quick and it's rapid. Molecular testing, because it's more accurate. Although it takes longer, it's more accurate. You wanted that, so that PCR piece. Number three, access to staff who could come in and help administer the test, because it is a big logistical lift for a lot of school districts and schools. And so could you have someone come in? And so that's why we have vendors who are going to be turnkey, who can come in and do some of the testing for you if you choose them. And then fourthly, access to grant dollars to support testing and mitigation strategies. So this is going to be direct funds that will go to districts that you can use for a list of allowable costs that I'll get into later. But we have a separate webinar for that, two of them next week. Today I'll touch on it a little bit, but that in detail will be done next week. All right, so K through 12 COVID-19 testing opt-in process. So public school systems that are part of the current testing program, meaning you opted in last school year or you did the stopgap program here in August, you do not need to apply to participate in this program. You're automatically rolled over. You don't need to apply. You just can start reaching out to vendors. The reason we did this is we wanted to eliminate as many barriers as possible. If you've already applied a couple of times, we didn't want to have you do that again. So you do not have to apply. This is for public schools that are already in the system, have already applied for our previous or current testing programs. Now, private school systems, any private school system, whether you've applied before and been in the program before or not, you are asked to reapply. And that's just because we want to verify some things. As TA, we deal a lot with public and not as much with private. And so we just want to make sure all of our information is up to date, so the allocations and our support of you is accurate. So all private schools, regardless if you were in the program or not before, we do ask that you go ahead and reapply. So for those who are interested in this program, here's some things that you need to think about that you're going to be attesting to, or saying that, hey, we're going to meet these requirements. The first one, you're going to affirm that to select and administer COVID tests provided to the vendor, you will adhere to all the reporting requirements. So each vendor will have its own reporting requirements. You are responsible for meeting those requirements. And if you fail to do so, it might limit you or eliminate you from having further access to those tests, because we have to make sure that everyone, that we're on the up and up with the federal government and that we're getting and reporting what has been used. Number two, you've reviewed all of the requirements and you affirm that your school system can actually meet those requirements. Ensure that you can meet those requirements. The third thing is, just like you've done before, for those who've been in the program before, you're going to select one district test coordinator to serve as the point of contact. So for private schools, you would just type that person's name in. For public schools, who you have currently as your testing coordinator, that's who we have already listed. If that's changing, or as you reach out to vendors, you can let them know that. But as of right now, we have a list of your current test coordinators. And this is going to be the liaison between the vendor, dishes, and TEA, that one point of person who's coordinating everything. The fourth bullet point, schools will need to ensure that they have appropriate space requirements to accommodate the type of test. So some of these tests might require a certain temperature, might require a certain space, so that the tests don't expire, or that they're being held as they're supposed to. And so you just need to, as you look at each vendor and see their specific requirements, that you actually have the space to accommodate the tests that they'll be providing. And then lastly, as previously required, public schools, it's just for public schools, you will continue to do your case report to dishes, the one that you do every Monday by 5 p.m. for the 7 days prior to that day of any positive cases. So that same system, 5 p.m., that continues. And then this will be aggregated at the state district level, and then we'll post that on the dishes website as we have been doing. So these are the requirements if you're going to move forward with this testing program. Just wanted to name that up front. So made a little table for you all. I'll let you look at it for about 20 to 30 seconds, and then I'll go through it. Okay, maybe we'll make it about 20 seconds. So here we go. So public schools, you can see public and private schools are down on the y-axis, and then around the x-axis it says should apply, should not apply, and eligible to apply. So just to reiterate this point, public schools that should apply These are public schools who would never in any of the programs, who never participated in the past programs, but wish to opt into this. You should fill out the application. If you offer pre-K to students and it's attached to your K through 12, that's fine. But if you're a standalone pre-K for public schools, this would not be the program for you. But if your pre-K is attached to a school, they commingle, they're in the same building, then as a public school, you should apply. Private schools that should apply. Any private school, whether you were in the program before or not, you definitely need to go ahead and reapply. And that same pre-K piece applies to you as well. If the pre-K is attached to your building or commingle in the building with other students, fine. But if it's a standalone pre-K or daycare, this program is not the one for you. You would not be eligible. Should not apply. Public K through 12 school systems already currently in the program, you do not need to apply. You're good to go. You can begin to reach out to vendors. We have your information already. If you need to update something, let us know. Ineligible to apply. So this is not, should not, this is folks who just are not covered. Any public or private school on that City of Houston list that I've talked about several times, and then pre-K only providers. So those standalone pre-K or daycares. So these will be folks that are not able or that are ineligible to apply. So I'm going to move on for there. The application link, you can go to it. Wanted to reiterate this. This is completely and entirely optional. You do not have to enroll in this program. If you're doing your own testing thing, or you have something else you're doing or prefer not to test, you do not have to go with this program. It's entirely optional. The application is up. It's on our website as well. You can go there and begin to apply for those who need to apply or wish to apply. So moving forward, switching to another gear, allocations. And so what you will see on our current website, the one that I showed you at the beginning, we have posted a list of opted-in public school systems and their allocations. So charters, publics, it's already there. Now, right now, our private schools are not updated. They will be updated very soon. And that's just because we needed to confirm some things. So as private schools apply, we'll be updating the list, and it'll be updated with private schools very soon. We just haven't put that in there yet. We're internally working through some things to make sure it's as accurate as possible. We have targeted the allocation amounts to be enough to do diagnostic testing, which Dave covered, and screening of some groups on a periodic basis. So it's not like it's an infinite amount, it's a definite amount or definitive amount of money. And so we want to make sure you guys use it wisely, and we'll get into that. TA and DSHS will evaluate test usage in January and may adjust allocations to increase support to schools that are active test users and reduce funds in school systems that are not using their allocation. So if you look at that allocation sheet, and I can show it to you briefly. So if I go to my allocation sheet and I go, it is right here. Let me just drag it over so you guys can see it. Let me blow it up. So if you look at it right now, let me go all the way to the top, live for you all. It has opted in previously or not. If this is not accurate, email us. We've been fixing that as well. The district ID, district name, the ESC region that only applies for public schools, district enrollment total, district staff, total staff count, and then the total population. And then here's the allocated amount of money. So what's going to happen in January? We're going to look at this amount, see what's left, and I'll get into the details of that. And as we look at the allocation, look at the usage of test, any school districts that we see are rapidly using their test and need more allocations, we'll move some money around to further support you. And then those that may not be using as much and don't need as much, we would reduce that to allocate it somewhere else. Any of those changes would be fully communicated to you all before those changes are made. We would not want to just make the change and not let you know. So wanted to point that out. So there might be a few questions here. Let me go a little bit further into this piece in terms of allocations. So what happens? You kind of saw you already saw the spreadsheet. So school systems will have a dollar value allocation for testing services. So that's the amount of money you can use when you purchase services from the vendors. And I'll get into the vendors in a second. So that's your amount of money in the bank, if you will. Each month, TA will provide school systems with an update on their expenditures and remaining balance. So as you begin to reach out to vendors and you get tests and you use your money up, we're going to update that allocation sheet so you'll see what you have left so that you can plan properly or change up your plan as you move forward, right? Because you might use a lot of money at the beginning or at the end, but we want to just let you know what you have left as you continue to plan throughout the year and respond to COVID. Tests provided under the K-12-19 program are designed to be used immediately. And this is very key, not stocked for future use. So these tests are not to be hoarded. As you get them, use them. We understand you might not use 100% of them every month, but you should be getting through the bulk of what you've ordered per month. We're trying to prevent tests going to waste or expiring. So as you get them, use them. As a testing coordinator, if that's you on the call, work with your team members, staff, and figure out, okay, based on cases and based on what we think we need, how many tests do we think we need for the following month? Expenditures will be monitored to ensure that school systems are not expending more than 20% of their allocated funds in a given month. So that means out of the 100%, so let's say you get 100,000 that was allocated to you, we want to make sure that in October, you're not using 50,000 of it, because now you've gone through 50% of your allocated amount and you still got a good 8-9 months left in the school year. So we want to help you manage that, and we'll reach out if you need support there, or you can reach out to us as well. Except for under extenuating circumstances. So there are outbreaks, there are situations where things happen. We'll understand that when things happen that are unforeseen, but just the spending or using tests in a way that isn't the best use, then we would intervene there. But we understand case by case things happen. TA and dishes will also compare test reporting to test orders to monitor the usage of tests ordered. So what's going to happen, and this is not posted yet, we're going to have an order form. So after you call a vendor, within 48 hours, you will submit this order form, and that'll go to dishes and TA, and we're going to reconcile. We're going to be able to see, okay, this is what Damon ISD or Hoyle ISD, that's my last name, Hoyle ISD ordered. We're going to now reconcile that with what the vendors have billed dishes with, just to make sure things are matching. So what you said you ordered on the order form versus, and compare that to what the vendors are billing dishes for, just to make sure things are on up and up and that there isn't anything that's misaligned, because we want to make sure that we're fair and people are actually being able to use the funding that they were allocated. In short, with all of that said, in short, we ask that school systems develop a plan. It is very key. The test coordinator, that's very key to get with your team, look at your current situation last year, and develop a plan for testing throughout the year. Order each month what you believe you will use for the upcoming month. Make an educated prediction based on what's going on. Report the test thoroughly and accurately, and consistently reorder testing supplies and services as needed. So definitely develop that plan. We know things might change as the year progresses, but be very methodical as you're ordering from these vendors, because it's an unlimited amount of money. All right, so now I've said all about the allocation and I've alluded to and talked about vendors. Now we're going to get into the vendors. So public and private school systems that are in the program can choose to work with any or all 5 testing vendors and reach out to them directly. So you don't have to go through us. You can call, you can email, and I'll show you a quick sheet that has all of that information on it. You can use one or multiple, or however you want to do it. And month to month, you can switch off. It's whatever meets your need for where you are. We wanted to make this as flexible and as user-friendly as possible. School systems may select the vendor or vendors that offer services best aligned for their testing strategies. Vendors will build dishes directly, so you will not be charged. You will order your test and they will build dishes, and we take care of dishes and we'll take care of that. So you do not have to worry about, will you be charged or do you have to have any money up front? You don't. It's on your end, it's completely free, but it's billed to dishes. So I'm going to click on here. This sheet that I'm about to click on is also available on our website. It is the vendor allocation sheet. So I'm going to show it to you very quickly just so you can get familiar with it as much as possible. Let me blow it up a little bit. So as you can see, it has each vendor listed across the top. All 5, 1, 2, 3, 4, 5 are listed there. And then down the side, it tells you the different pieces. So test administration, scheduling of turnkey option, if that's an option, electronic registration, and it goes down. PCR, it gives you the amount. So that's where that, when you're buying and you're looking at your allocated amount, that's where that comes in, because it tells you how much each test costs. And so as you buy, that'll be taken from or deducted from your allocated amount. Now, and you can read that short, it's pretty self-explanatory. I wanted to highlight this group right here, Affinity Empowering. So this is an additional vendor that is available to any system to use for free, which only provides pool PCR testing for purposes of surveillance. This is funded by FEMA and uses a different process for accessing it. So if you go here, this wouldn't come from your allocation amount. This is completely free and that's covered by FEMA. The other 4 would come from, so if you have $100,000, if you order from them, these 4 would be deducted if you order test, or whatever you order from them will be deducted from your amount. But this 5th one is not from your allocated amount from us. It is completely free and paid by FEMA. So I wanted to make that distinction there. And so this is available for you on the same website that I mentioned at the beginning, our COVID testing website. And I know we're moving pretty quickly, so if you have questions, we'll answer them as soon as we can. All right, let me go back to the PowerPoint. So those are the vendors. The resource sheet will help you compare testing vendors to determine which is the best fit for your school system and community. You click there, you can see the full size. All right, so webinars. If you're interested in these vendors, we strongly suggest that you go to the webinars. They begin next Monday. Here they are. They're also listed on our website. You just click here and you would pre-register to be at those webinars. And they're all listed right here. So definitely be there so that you can hear more. It's one thing to have the quick sheet. It's another thing to actually hear them and be able to ask questions to see if it's the best fit for you. So I'm going to move on from there. So special note here, special note. Urgent need for tests. We recognize that some public and private school system districts are in need of tests in the very short term, meaning immediately, right? That is why we opened the outreach to vendors as of last week, as of last Thursday, for those who are in very high need. And I want to stress here what high need means. We do ask that you hold off on contacting vendors typically until September 16th if your need is not urgent. So when we're talking about urgent, we're talking about you had an unforeseen outbreak where you are out of tests now or about to be out of test on Monday, and so you need to have those tests. That's what an urgent need is, that you don't have enough tests to last you between now and when the new one begins and you have like an urgent outbreak or something along those lines. So that's what we mean. You can go ahead and start reaching out to vendors now. We've told them they're expecting it if it's an urgent need. But if not, we ask that you hold off until after Thursday when we officially launch the program or the project to begin reaching out to them. Now, want to clear up something just so we can manage expectations. If you call them today, you will not get tests tomorrow. You should not expect to receive tests from vendors before the 16th because there's a period of onboarding. Each vendor requires some different onboarding and different things for them before they can release tests or show up on your campus to administer tests. So just know that there's a process for each one. But if you reach out to them shortly, you will be lined up to be helped or for them to reach out to you as soon as possible. So the quicker you reach out, the quicker they'll get to you, but we ask that you do that as of right now if it's an urgent need. Reminder, we will have vendor webinars. I already kind of went over those next week. So I would definitely strongly suggest go to the vendor webinars, check out their website, understand who it is and what it requires before they show up on your campus, because once they do and you order, then you're responsible for meeting those requirements and so forth. So moving forward. Now, speaking of requirements, reporting, always a fun topic. For all testing, each school vendor must meet specific testing reporting requirements using a web-based portal. So all of them have a web-based portal. And so if you have 3 different vendors, you'll have to report to those 3 different venues. So if you choose one, you do one. But whatever vendors you choose to supply your test and to meet your testing needs, you have to meet those testing requirements. And if you fail to do so, it could result in a loss of being a part of the program. All school systems must submit, and I talked about this request report earlier, or this request form earlier, within 48 hours of receiving tests. So once you call the vendor or email them, however you reach out to them, within 48 hours, this form is not live yet. It will be live on the 20th. You'll submit that to Dishes and TA, and then we'll use that to reconcile what you've ordered versus what they've billed to Dishes. So that is also going to be a requirement, that form. For positive cases, this is pretty standard, what you've all been used to. Campuses must notify individuals on the case of a student under 18. If it's students under 18, you notify the parent. If they're over 18, you can just talk to them. In the event of a positive case, you got to notify them. Number 2, public school campuses must provide notification to their communities of positive cases within the classroom. So for public schools, not private, but public schools, and this is consistent with the TA public health guidance that's also on our website. All school systems must notify their local public health authority. So that's public and private. If there's a positive case, you need to reach out to your local public health authority and notify them with whatever protocol that is. And then lastly, public school systems must report, I've already gone over this, the pre-existing Dishes COVID case report that you do every Monday by 5 p.m. That has not changed, so that's still a reporting requirement. So there is some reporting requirement here. definitely want you to be familiar with it and know it, because we all have to hold ourselves accountable to it. All right, so now that's vendors, that's testing, that's allocation. I'm gonna put a pin in that, and now I'm gonna switch over to that fourth piece I talked about, which was grants to schools funding. So within this grant, $221 million has been set aside. And so TA will launch this process and these funds very soon. We have a webinar next week to learn more about it. But you'll be able to get these funds out of this 221 million for some allowable costs that I'm gonna go over. We'll release more, like I said, next Monday on the 20th. We have a couple of webinars on the 20th and then the 21st. The allowable costs. So you can pull down this money and you can use it for PPE. You can use it for hygiene and cleaning supplies. You can use it for portable, high efficiency HEPA and fan filtration systems or other small items that may allow you to improve air circulation. Public health events that include vaccination campaigns, or if you want to do something around COVID prevention and detection, you can hold an event and this money can be used to cover that event. Vaccine promotion. We'll cover it more next week and get through all the details of what the allowable costs are. But we wanted to provide this because we know with the vendors, it may not cover everything that you have a need for. And so we hope that this 221 million can help support those other needs that you have when it comes to your campus and supporting COVID mitigation. But more to learn about that next week. So the two webinars on the 20th and then on the 21st. I'll make a note. As of right now, public schools are definitely covered. Private schools possibly are probably going to be covered. And so what we will say here, and we'll have a definitive, if you're public and private, come to the webinars. By Monday, we'll have a more definitive answer for you. We're still just checking off a couple of boxes to make sure public schools are definitely covered. We're just checking a few boxes internally to see if private schools will be allowed, but we'll know more about Monday. So just want to throw that out there because that might be a question. Resources, last couple of slides here. So if you have a question, when in doubt, who to go to. If you have questions around best practices for how to use your tests, public health guidance, test coordinator support, or grant questions, you would email TEA at COVID case report. I'm the one managing that account. So email us out to COVID case. And then if you have questions though about vendors, so it's specifically about a vendor or an issue with a vendor, concerns, delivery, reporting, you then reach out to Dishes and you would email them at this website here. I said this website, at this email address, this tcec@dishestexas.gov. That's who you reach out to. And this slide deck will be available. It's already on our website as well. But these are the folks you reach out to between TEA and Dishes if you have a question. Now, on our website, which I've already referenced, we have a lot of information that we've provided. We try to be very resourceful and try to be preemptive because we know it's a new testing program and it's can be a pretty heavy lift. And so we're trying to provide you guys with as much as we can to provide you so that you know and you can make the best decision for your school community. So you'll find the testing playbook on there. So this slide deck or version of it, the vendor resource sheet that I showed you earlier is also on there. List of opted-in public schools. Application for the new school systems. If you need to apply, the application link is there. An FAQ that's going to be updated regularly. And then testing reporting form is coming soon. Let me do this really quickly, and then we'll get into some Q&A. Just so you know what it looks like, you go here, you click on COVID-19 testing, and everything is there. And one thing we're really good about is as things are updated, you'll see the date change. So our FAQ was last updated on the 9th. It'll be updated again this week. And so you'll see as things are updated to see what's most current. Our vendor sheet was actually updated just yesterday. So it's as accurate. It's the most accurate version we have. So definitely check out the website. It is definitely there for your support. Gonna go back. Next slide here. And then these are just some 3 last additional resources. An overview of general guidance for the ELC grant. So this grant, if you want to hear more details about it or read more on your own, you can go here. It's called Open and Safe Schools. When to test calculator. It helps you figure out when you should be COVID testing and so forth. You can go there. And then the CDC, obviously, right? The one we all go to for guidance. This is a link to their testing toolkit. So that's another resource for you all. So with that said, I'm gonna end with this required statement and then we'll get into our Q&A, and we still got about 15 minutes, so perfect timing. This K-12 19 testing project is supported by the CDC of the U.S. Department of Health and Human Services as a part of the financial assistance to award totaling $800 million with 100% funded by CDC and HHS. The contents are those of the authors and not necessarily represent the official views of nor endorsement by the CDC, HHS, or the US government. For more information, please visit the Center for Disease Control website. So just a requirement notice there. So I'm going to move on now with 15 minutes left, and let's dig into some of these questions. Once again, all of them may not be able to answer here, but we'll get through as many of them as we can. All right, let me go to the top here. So first question, can we update the application to include pre-K students on the campus? We submitted the application already. We will have a process for you to update it. I will reach out, this is Jim Barza, I'll reach out to you because we either want you to either reapply or anyone that's applied between yesterday and today that didn't include pre-K, I have a copy, I can email you. So we'll reach out to you after this, but we will get your updated numbers. Who is providing the standing? Can a district recover funds for the staff member conducting tests or staffing funds only available for private testing companies? So this is strictly through the vendors. Anything that you're doing is through the vendors. In terms of supplanting, we're not doing any of that. So anything that you want to in terms of recovering a staff member, no, that's not covered here. To answer that question, hopefully I answered that clearly. For schools that have an attached daycare, okay. Ages 6, can we include those students and staff? We all share the same building. Great question. As of now, what it says is pre-K, specifically pre-K. It doesn't talk about daycare. It talks about pre-K being attached. I know you're saying that daycare is attached. That's a very specific question. Let me get back to you on that because I want to give you the right answer. I'm leaning towards probably not, but let me get back to you in terms of them being qualified. So I'll get back to you. I see this as an anonymous attendee, so we can update our FAQ with that specific question. Based on the first question. Will there be different reporting mechanisms for the different kits? Would we still be using the Texas Rapid app? So you will use the Texas Rapid app for all your Abbott Bindex Now tests that you have through the current program. But once we move over to this new program starting on the 16th, no, these vendors will have a new and totally different testing requirement. That's why we're having the webinars. That's why we have the quick sheet. And that's why I have their contact information, because when you choose a new vendor or you choose vendors, they each have their own reporting requirements. They're all an online web portal, but it's not the same one that you've been using through the Texas Rapid app. So no, it's going to be a different reporting mechanism. On the new instead of individual. Okay, so on the new list of district enrollment staffing that now shows a dollar amount instead of individual numbers of PPE supplies available, is this amount in essence a credit that we allow through dishes to purchase the test? I'll get back to you on that, but it's so let me explain the dollar amount. Let me clearly explain. We got $800 million from this grant to the state of Texas. We're allocating and distributing that across districts that are eligible, not on the Houston list, not pre-K standalone, not daycares. That money was divided and we looked at current staff enrollment, current student enrollment, and then allocated, use a principle/formula to allocate an amount of money. And then that amount of money is what you can draw from and pull from as you reach out to vendors to get testing on your campus. Then there's a separate $221 million within this grant where you can get direct funding for allowable costs that I went over, including PPE, different vaccination campaigns, HEPA filters, and we'll go over more details with that component of the grant on Monday. So that's when we talk about the different money, that's how it's set up in short. Can we update the application to include? Yes, I've already answered that. We'll reach out to anyone who's already applied under the pre-K piece and you excluded pre-K. I'll be reaching out to you. I can tell when you applied and when you didn't, and we'll get you updated. So the Houston spreadsheet, someone asked, is there a contact, a phone number to contact Houston? We will be getting you that information shortly. We're just working internally to get the direct person to reach out to, but we'll be able to provide that information as well. But if you're reaching out to them, you know, you can, but we'll also be able to provide that information, hopefully within the next 24 hours. This is a recording. This recording we will make this available. We have recorded all of these. So this is currently recording. What is the deadline for for private schools to opt in? Right now, there is no deadline, so just go ahead and apply. We have not set a deadline for it. Go ahead and apply. If there ever is a deadline, we will let you know, but right now there is no deadline. So go ahead and apply. And if you want, when I say apply, if you want to wait to hear the vendors next week and just to see what they're talking about before you, then that also, I think is also a wise decision to kind of get through the vendors to see if it's even something you really want to pursue. Is there a consideration to change? So are you able to order from TDM in the transition? As of right now, as it stands, the TDM program stays available until the 15th, which is Wednesday. Yep, end of day, midnight. So if you're ordering from them, resupply, we're fine there. But after that, you would then switch over if you're interested to this testing program with us. So that's how that would happen. We're adding new staff. And let me say this, if you have tests that you don't use up from the current testing program, you're still able to use those. So that doesn't mean you need to throw those away. Now, if you do not want the test, the Abbott Buy Next Now, and you're not using them, contact TDM and return them, because they would love to redistribute them to schools that want them or to other folks that need them. So if you have Abbott Buy Next Now tests that you're not using and you don't foresee using, you can reach out to TDM and return them, and they will reallocate them to other people or to other folks who need tests. Because of the instruction about the number of students is unclear, we need to resubmit. Yep. What do I look to find? Yeah. So someone wants to know, what do I look to find out who is listed as the point of contact for my school? Email COVID case report, and then I can email you who that person is, because as they apply, we pull the report, and then we can see who the submitter was and who's the designated test coordinator and alternate test coordinator. And I have had staff use Texas Rapid. They're not allowed to create it. So if you have a question about the Texas Rapid app, there is information, and if you email COVID case, I can provide that, or you can email TDM at klogs@tdm.texas.gov. But I can provide you the information to contact them to figure out how to get you in Texas Rapid app to make sure you're reporting your test. So if you just want to be safe and email COVID case, we'll get back to you with who to contact. On the vendors, the same test. So someone said it's interesting the wide range of prices among vendors for the same test. Any known reason? Do the more expensive tests include administration fees? And so different vendors price their test based on their internal formula and how they need to price it for whatever accounting purposes they have. Now, when you talk about do the more expensive tests include administration fees, as you look through it with the testing, if you do turnkey, if you look at a turnkey option, that's when they come on your campus and they actually administer the test. But if you're just ordering the test directly, like the rapid test, then you yourselves would administer that. So when you talk about administration, if you're doing the turnkey piece, they come on your campus and do it. If they do the testing and the reporting, if not, then you administer it and you do the reporting. So let me touch on this. So folks are asking about personnel. So, and I'm not going to get into all of this. There is another grant that we have, a nursing grant, $39 million grant that we allocated to education service centers for them to then look at different ways to allocate that amongst local education agencies or districts for the need of hiring nurses in places that are most needed and districts that are most needed. And so that is a grant that is directly looking at funding for nursing. If you want further information about the nursing grant, email COVID case and I can supply you with that information. Private schools may not be covered. So any private school that is interested in applying for this program can, but if you are a pre-K, standalone, or you are a daycare private school, then no, you wouldn't be eligible to apply. Now, on the other end, the 221 million, we're confirming that, and we should know within a couple of days, if not within 24 hours, a couple of days, if you all qualify for the 221 million. By the time we do the webinar on Monday, we should have a definitive answer. I don't want to give you a yay or nay yet because we're still trying to see if we can cover private schools. How effective is the antigen test, people without symptoms? What I would say for the antigen test piece and symptoms, a couple of things. You can reach out to the vendors because each of them use a different type of antigen test. And I'm sure that each antigen test that they use, if it's a different manufacturer, has a different level of accuracy. And so I would reach out to them directly. Regarding ordering other items covered by the grant, such as PPE, do we order through the same vendors? So right now, the vendor piece is not looking at the PPE. For PPE, you can go through and look at the 221 million piece grant, because that can give you direct PPE as well. So if you're looking for PPE, then my suggestion is to go look at the $221 million grant. And right now, that grant will be available for funds to actually pull down mid-October to the end of October is when those funds will be ready, towards the middle to end of October, sometime after that. But we'll talk more about the 221 million on Monday, because I'll be there, and then one of our grant specialists within TA will be there to get more granular with those questions. Let me see a couple more questions. COVID case K-12 more tests, but I have not heard. Supplies are used, then order the TA. So someone asked this: do we use the current supplies that they have from the current testing program, and then once those are used up, order from the TA supplies? So this is an approach kind of question, or best use case. So you first of all need to look at and see, okay, how much you're using per month, and looking into the next month, what you currently have in stock from the current program, would you be able to use that? And if you're going to be using it up, then we would say you can go ahead. Let me back up. If you want to order from the vendors, you can go ahead and start now. That way, by the time your current tests are used up, you can go ahead and already have a new supply coming in. We want to avoid you guys having a lapse. So you don't have to wait till you use it up. You can order it now and have it, but just be mindful that you're not storing tests. So you kind of need to weigh and look at, when am I going to run out of tests and when do I need tests? If you need more specifics, you can email us at COVID case and we get more granular there. If we never receive tests from TDM due to no response, do we need to just reapply and use? So I'm not sure if this is a public or private. If you've applied to the current stopgap program, then your test should have been fulfilled or will be fulfilled. But if you're saying that you've never applied to the current program, then what I would say is you have until tomorrow, the 15th, to Wednesday, close of business the 15th, or in the day on the 15th, to apply. And then after that, you would then have to switch over to this program if you want testing from TEA.
Hey there, Damon. I think she is asking that they applied. Rachel, if we've never received tests due to no response, do we just need to reapply and use the new vendors? And Rachel, I would say go ahead and just opt into this program and start contacting a new vendor.
Got it. Thank you for that clarification, Julie. Take a couple of more questions. I think we've answered. Please report. Now, some of these questions I'm not able to answer right now, and I don't want to give you wrong information. What we are doing, and I'll repeat this, I'll reiterate this, is that we do have an FAQ that we're going to be updating constantly. And as we see questions emerge that are not just specific one-offs, we're going to be updating our FAQ. We have taken a note of every question in here that was or was not answered. And so we will be able to follow up either individually, or we'll be able to follow up via our FAQ. And if you feel like you need your question answered immediately because we didn't get to it, then feel free to email COVID case report, and then we'll get back to you. And if you need to be redirected, we can always redirect you to either TDM, to dishes, or to whomever you need based on your question. I'm gonna look through here. Let me just cold call my colleague, Dave. I'm not sure if he's still there. Did you have anything else you wanted to share before we get out of here in the last 2 minutes?
No, I think that's, you've covered most of it. I think you did note, and I want to emphasize that any ISD or school is not limited to a single vendor. You can contract with multiple vendors. So I just wanted to emphasize that aspect of it. Just because you select one doesn't mean you're solely committed to that particular venue.
Got it. Thank you for that clarification. And let me see if I can do one more here. Did you have something, Julie?
I did. I'm going to jump in. I've gotten a lot of questions about expired Abbott Buy Next Now test kits. And so I just want to make sure that everybody had seen that Abbott extended the expiration date on their Abbott Buy Next Now rapid tests. And so you want to check your lot number against their updated expirations to make sure they are indeed expired, because in most cases, they're set to expire in October or November. So you might have a little bit of life left in those. And so I'll go ahead and put that link into the chat so you guys can double check.
All right, thank you, Julie. So I see that we're at time. As I said at the beginning, I know we didn't get to every question. We have captured and are capturing all the questions, and we will be following up, like I said, via FAQ. If you still need something answered immediately, email us at COVID Case. But thank you all so much. We look forward to continuing to supporting you with the rapid testing program if you choose to opt in or enroll. Thank you and have a great one.